For those who are joining first time, Vattikuti Foundation is a not-for-profit organization based out of Detroit and is the responsible for the birth of robotic surgery. And since then, our mission is we try to educate surgeons to use new technology, leverage new technology for developing new procedures, and at the same time, we experience down the line that until the recipient of this or beneficiary of these technologies is also mentally prepared. So we of late started training patients also. And we try to bring in pertinent subjects at the right time for public debate. It was the genesis of this webinar is few weeks ago, we had done a webinar with some of the common participants, which are present today, on telemedicine. And that was done to really look at the current status of telemedicine in India. Particularly, the subject was pertinent because of the COVID times. It was somewhere close to the second wave of COVID in India. And at that time, it was a very largely participated webinar. And during this discussion, I thought that one angle was missing because telemedicine has several facets. It has a technological angle, it has the last mile problems, it has connectivity issues, it has acceptability by physicians and all. And then through WhatsApp communication, I tickled Vidya whether we could do part two of the telemedicine, bringing what is the physician acceptability to this, whether it is going to wither with the wave of the COVID or we are going to see a resurgence of telemedicine as it is being observed in the rest of the globe. And that's how I must congratulate Vidya to have worked so hard and put one of the best panelists because I had the taste of it in the rehearsal she conducted a few days ago. I think to set the ball, I've set, though their content I have seen is excellent, there's nothing, in fact, there's a lot of learning for me. But I would like to set the ball roll by setting the objectives for this. The purpose is not to offload the knowledge of your subspecialties in telemedicine, and that's why you are sitting in this August panel. Purpose is to really to educate. How can we really, telemedicine either or physical medicine, either or is not going to do. They are complemented to each other, and we are looking for an ideal hybrid. And what is that ideal hybrid? Which would improve the quality of patient care, bring down the cost of the medicine, take away the extra load from the hospital for the unnecessary patients. What kind of technologies we can bring in. And second is, one is patient acceptability, then the environmental acceptability, and the third thing is the physician acceptability and the business angle of telemedicine, which would be brought in. Because hospitals have not done their homework as I interact with most of them, and they are really enamored with the inpatient heavy hospital system or what you call eminence based medicine, and they are not really wholeheartedly accepting it. If my take is that most of it was, except for the players who were already in it, most of them were doing telemedicine. Most of it was a compulsion because they wanted to really catch up with during the COVID time, and there was no other option to keep their teams safe. But I feel, and I have no data, but I have in my mind calculated that telemedicine is the only way for them to enhance their business, keep containing the infrastructural overload in the hospital, which goes a long way to compromise the quality of care.